must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show. Hey everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. My name is Brandon Pollin, and of course, as always, I am joined by my other two great co-hosts, F. Scott Fiel and Stephanie Wyrock. And today, we actually have the pleasure of having a large group of people on the show today. And actually, to be honest, this is definitely the most people we've ever had on a single episode. As today, we're interviewing 3 students and a faculty member from the Columbia University DPT program to really talk about kind of their student-run elective that they've kind of developed. So with that, we have the pleasure of having Dr. Lonnie Stewart, who is the ACCE and the Director of Clinical Education at the school, along with Joe Lipsky, James Sinodinos, and Sean Whited. So everyone, thank you so much for coming on. And, I appreciate the perspective and the time. And, if you guys could kind of briefly go down the line and kind of introduce yourselves, starting with Dr. Stewart and then Joe and then James and then Sean.
Yeah, sure. This is Dr. Lonnie Stewart. I'm really happy to be on here, and I am the Director of Clinical Education. I'm an Assistant Professor of Rehabilitation and Regenerative Medicine at Columbia University Irving Medical Center, and I happen to be the faculty advisor for this student-created, student-run elective.
My name is Joe Lipsky, currently a third-year DPT student at Columbia University, finishing up my clinical education at Exos in Phoenix, and I, along with Sean Whited, am one of the co-founders of the Perspectives on Practice Elective.
Hi, my name is James Sinodinos. I'm a second-year DPT student at Columbia University. I'm the second generation of the Perspectives on Practice Elective. I've followed in the footsteps of Joe and Sean in classes right now, doing my second clinical affiliation this summer, and yeah, that's it.
Hi, my name's Sean Whited. I'm a third-year DPT student as well at Columbia. I, with Joseph Lipsky, created the Perspectives on Practice elective with the help of Dr. Stewart guiding us and directing us. I'm currently in my last affiliation for clinical internships at Spear Physical Therapy in New York City. And I'm a career changer. I used to be a professional musician prior to going to graduate school for physical therapy.
Wow, what a great breadth of students and also a clinical educator and professor from Columbia that's joining us today. I'm really interested in where this idea of a student-run elective came from and how you guys worked as a team to form this and kind of what this all entails. So could you give us a little background about that?
I'm actually going to start it off. I'm going to hand it off real quick to Joe and Sean, because I was an adjunct professor teaching them a course, and both Joe and Sean came up to me and knew that I was in private practice and wanted to start a club on private practice. And I said, well, I might not be able to do everything, but I know some people, and we could come up with something. But they took it a little bit of a step further. So I'm going to let Joe and Sean go into that.
All right, Sean, maybe I'll give a bit of the backstory, and then you'll dive into the actual process, because I think that was your real bread and butter, is really selling the program on how it's going to be beneficial for both the students and the faculty. So Sean and I were in the midst of midterms in our first year, second semester. And Sean came up to me and was like, Joe, we should start like a networking club, a private practice club. I'm like, yeah, it's a great idea. Sounds good. What would that look like? And we started looking into it. We realized we needed a faculty on board. So that's how, we asked Dr. Stewart. We went to Dr. Krasinski with the idea, and she was like, interesting. Why don't you guys take, X, Y, and Z into consideration and come back? And I think Sean would be able to better answer the rest of it. But that was really the backstory. We kind of just were interested in like, hey, we want more business education and we want to really take advantage of the Columbia University network. That was really where the idea was.
Thanks, Joe. So I had a huge interest in business owner and private practice because I was a business owner in my former career. And that's why I approached Joe. So when we spoke to the director of our program, Dr. Krasinski, initially there was a little pushback concerning, we already had some business elective in the curriculum and how this was going to be different. And we really kind of painted the picture of what our idea was and how it was different in respect to this was an opportunity for students to really take charge of their education, reach out and find someone that's a specialist or a leader in the field in that area and come in and lecture. It would give the students an opportunity to make meaningful networking opportunities for themselves and for their classmates. And it would also help the program to develop relationships with the physical therapy community and the leaders of that community. So it's oftentimes the way the students see it is that there's a large difference between the way the academics are run and the way practice is really handled. And concept and the way that we presented it was that this was really the marriage of the two so that everyone on all sides would win and be able to benefit from this.
I'm in private practice, Sean, so I really appreciate that you guys set this up because as a student, when you have your business class and you do your business plan, you don't necessarily really think about the real world concepts behind it, I think. And the fact that you guys made a part of the curriculum for this specific course to go out into the community and find physical therapists that would present content to you is really quite, I think, impressive because in private practice, we need to be making those relationships, not only with physicians or referral sources, but with our own kind, with physical therapists, with local gyms, because as private practitioners, we are clawing and scratching to make sure that we're getting our patients through the door. And so the fact that you are working on this skill is really, I think, quite impressive.
Yeah, no, I would totally agree with all those comments, Steph. And first I want to ask this question first to Dr. Stewart here, because I'm kind of curious, as they kind of mentioned before, the initial pushback of kind of starting this up. But, and of course I'll ask him this, and then if anyone else has anything to add, please feel free. But, what are some of the pros and cons with having a student run elective class as part of the curriculum?
Well, okay. So first off, I didn't even really know that this thing took its own legs behind my back, because when the next time that Sean and Joe came to me, they're like, Dr. Krasinski, who's our program director, love her to death, said this is going to be a class. And I was like, oh God, what have I gotten into? So one of the positives is that the students created this. And then one of the negatives was, or one of the challenges was that the students created this. And I'm getting my Doctor of Science degree at Rocky Mountain University of Health Professions. And so I was just at the same time learning about building a curriculum and teaching methods, et cetera. So this all came together at the same time. And it was a lot because I was still learning about how to put a course together. And I was by no means an expert, but now I'm at Columbia University, right? And now these students come up to me and want my help. And I was just like, let's just get down in the dirt and do this. So together. So this whole thing has been a learning opportunity 360 for all of us. And it's really enhanced my teaching. And I think it's enhanced their idea of just what they're getting into. I mean, this is a tremendous profession. And already we've had people come onto our little program on the 8th floor of the Neurological Institute to talk about what it's like out there and the different kinds of problems that they're dealing with. And also really big issues like payment and reimbursement and the perception of physical therapy and how do you keep your patients. And so I guess my point is being that we've learned a tremendous amount about what's happening on the ground out there that you don't get when you're looking where you're doing your special tests and learning the nuts and bolts of an exam and eval. The challenges have been met together with the students and myself, and I think we've met them really well. It's made it for some really interesting discussions.
How cool that you were able to do this curriculum while you're doing your Doctor of Science. Wow, that's crazy how those worlds collide. And it's so cool that everybody gets to learn along with you, Dr. Stewart. That is incredible.
It was a little too much at times, but it was all good. No, it was great.
I was going to jump in. A major pro as a student was because I jumped into this course a little bit after Joe and Sean already had it on the ground. I remember going to their first meeting and being extremely interested in their vision. And I was particularly interested in a certain topic that I wanted to hear more about. And Joe and Sean just said, go outside of school. They gave me the freedom and the platform to say, go out, network, communicate with professionals that you want to hear about, and then bring it back to Columbia. And it gave me the opportunity to coordinate a lecture and hear something that I was interested in and that other students in my program were interested in. So a major pro of this style is that it gives students the opportunity to learn more about what they're really interested in, and to step outside and network and learn how to handle yourself as a professional with people that are, at the top of their field, and learn how to communicate with them and learn how to coordinate. So that was really cool as a student to be able to do that when I was just a first going on second year in the program. So that was an amazing opportunity.
I'm just going to jump in really quick and say, I think in our faculty meetings, there's a topic of discussion that's always about how students are acting or not acting professional. I mean, it seems to be something that we're always working on. And this course allowed students to take the lead to go out and to present themselves to other professionals, to bring them in, design the course, and then put together a series of lectures. And it really was its own professional development mechanism, which I thought was really great.
How did you guys pick James to be the mentee? That's what I want to know. I think it's so cool that you have found somebody to fill your shoes. And I'm wondering why you picked James. And then I'm also wondering who James is going to pick next. And if that person is listening, do they know they're being picked?
So I'll go ahead and jump. That's a great question. We wanted to make sure that our following into this role would really be people that wanted to see this thrive, that really understood the vision of what we were trying to accomplish. And it's not just a class. So we spent the first semester really, we had, I think, almost 6 or 7 class meetings that first semester for this course. And we found who was attending regularly, and we offered all of the regular attenders that were really interested and had participated a lot to try out, if you will, for the position and do an interview. So we approached them. They wrote a little blurb about what their vision is of using the platform to continue going forward. And then we took them and did an interview process. So Joe and I actually got some management type experience where we were able to sit down with Dr. Stewart's help and develop an interview, some questions, go through that. And after we had done the interview, we originally had 5 candidates, and we chose based on who fit our vision of where we wanted to take this, their understanding of it, and even their ideas of what they wanted to accomplish if they were chosen to be course directors going forward. So James had participated a lot. He very early on saw a lot of potential for our vision and really showed a lot of interest and just gumption, just getting things done and excitement in it. So he was a natural fit for us.
I think that's great, guys. And, one thing that I'm kind of curious that you kind of just alluded to, this has kind of prompted me to ask this, is in terms of the vision, what are you guys looking to add or change or modify with this kind of what you guys have done now to continue to make it better, to make it continue to progress like you guys have been doing?
One thing that I've been thinking about a lot recently is, really 2 things. One is make sure we're capturing what the class wants to learn more about. And I think so far we've done a good job of taking a pulse of the class and seeing what the areas of interest are and tailoring the lectures to what is meeting the students' desires. And I think I need to do a better job in the future about either sending out polls or forms or just doing a better job of surveying people in our class. What do you want to get out of this class? What do you want to hear about? What particular types of people or what particular topics do you want to learn more about, so that we can either encourage people like Joe and Sean encourage me to go out and network, or I personally can go out and try to find someone that would be a good lecturer at Columbia. And secondly, just doing a better job of documenting how each lecture goes in terms of what students' opinions are of the lectures, getting formal reflections of what they got out of it, what they can put into practice in the future, what questions they would have liked to ask, other things like that, and really get a firm documentation of the events and how students are perceiving these events.
One thing that I think is really cool about what you guys have described is the fact that you, Sean and Joe, really sat down and interviewed people and wanted to make sure that the people that they quote unquote hired matched the vision of their specific program. And we had talked earlier about where you guys are in clinical rotations. And I know one of you is at Spear, and we had talked about how they have a really good culture. And I think that that's so important in private practice, is making sure that you are hiring people or viewing people based on the culture that you want to create, especially as a manager, because that's what's going to make a successful private practice. And that's what's going to make your patient care better than anybody else's, and attract people into your clinic, is that great culture. So I think that that's really an important lesson for our listeners to hear, is that, when you are interacting with other professionals or networking at conferences or even within your class, making sure that you're thinking about what is the mission that I want to accomplish here, and how are these people going to help me achieve that mission. So I think that's really a cool thing that you guys have done.
Yeah, I think you also bringing up Spear is just a really good point. And Dan Rutenberg, the president, has just been such a fundamental and essential asset to us in the entire course of really my educational career at Columbia. He came in, spoke during our first semester, and then from that point on, Sean and I agreed, once we wanted to start this class, he was someone we had to bring on immediately to come speak. He was, I think, our second speaker. He gave a phenomenal presentation on leadership. And from that, our relationship has just grown. Dan brought up some of his clinical directors during the class, which allowed for, we probably hung out for at least an hour after Dan finished presenting, just talking about what life is like after school, what it's like directing a clinic, what's Dan's experience owning a clinic, what's that difference. Maybe you don't have an aspiration to own your own place, but you do want a leadership role. And I think a clinical director role is, a perfect fit. And we're also in talks with them of possibly doing almost like a pseudo ICE day, right? So as if student were to go in and shadow a therapist, a student were to go in and shadow the clinical director and see what a day in the life of is of a person in the managerial role. So what decisions are they making every day? What problems are they facing? What kind of things just pop up on a day-to-day basis? And it's things like that that really make this class special, just because, we've developed this living syllabus, and as it grows, we grow. And there's just so many different areas that I think this class can potentially lead to different educational opportunities. You think about in-classroom experience and then out-of-classroom experience. This class really provides a platform for both. And then if we were even talking about creating a podcast for the students. That would be another way that students can kind of develop more content for the class, reach more people, especially via the internet, like we're doing right now, right? Because right now we're limited to geography. So, honestly, I think the sky's the limit for this class, as long as we can continue to find, motivated students like James to, keep this thing going and have a vision completely for it on their own.
Yeah, Joe, I'd have to agree with you there. The sky really is the limit. And you could make the course into a podcast very easily. I mean, even if you just record each session and release that as the episode, there it is right there. I mean, that's pretty easy to do. But, I think so many people would gain value from that. I don't know what the loopholes and the red tape might be with doing something like that, but it seems like it's pretty easy. But since we are talking about school and class here, I do have to kind of bring it back to the educational side of things and ask. I'll start with Dr. Stewart, and then we can kind of go if you guys want to add. But was there any sort of research that you guys used that kind of supports student-run classes in higher education? And did you guys as students bring that to present when you made your pitch?
Ooh, I can't tell whether they brought this stuff to their pitch, and my guess is they didn't, because they didn't quite know yet. But what I was in the depths of learning at that time was about learner-centered curriculums and about student-centered learning. And so we were moving away from Bloom's taxonomy, which takes up so much of how we devise curriculums and learning objectives, and now talking about Robert Marzano, who took the concept into like metacognitive systems, like learning how to learn. And so he kind of, I don't know if you're familiar with Robert Marzano, but he kind of took Bloom's taxonomy and kicked it up a notch. And so this whole class really fit into the learning how to learn. So we had to give it some structure, and it also was in line with Dee Fink and her creating significant learning experiences. And all of this was intrinsic motivation from the students, so that made it meaningful for them. So every speaker that came for the first couple of meetings was very highly attended. And this all came directly from their motivation to want more from what they were learning peripherally in the classes. So that's kind of like the general scope, but then specifically we take a look at the literature as well a little bit later. And there's some examples of student-led electives in medical school at the Alpert Medical School, Brown University. They have an elective on health disparities that's student-run. I've seen other examples like student-run pro bono clinics, but that didn't quite fit into what we were doing. So the literature is a little lean, but it's happening out there. And I have yet to see anyone that's published anything that's happening at PT schools at the moment. But
Side note, are you guys considering doing some research on it? Because if not, that needs to be in the works, I think.
Yeah, I think with Joe and Sean, we did one poster for CSM, and then with James's group, we're thinking about how we can get some data out of this, probably qualitative, do some interviews and see. And also, I was just going to say, one of the challenges is assessment. So how are we assessing how well we're doing? That is one of the challenges I see in these other student-run electives. They're a little lean on the assessment section too. So it's like you kind of do the thing, but you don't quite reflect on it. So one thing that we do, sorry.
It's tough to come up with an assessment when you're the pioneer. When you're the first one out there, there's nothing to compare it to. So you're kind of building the plane on the way down,
Totally. Or as we're flying it. And so what we're doing is we have students reflect after they come to each lecture. What did they learn about it? What had they wished had happened during that lecture? And then we're hoping to do some cumulative assessment at the end to ask students like, so what do you think? What did you like? What didn't you like? What would you like to see change?
So I can speak to Joe and my understanding of the research as far as student-run education goes. We didn't know the research going into it, just plain and simple. We just knew that we wanted to learn stuff that we weren't seeing in the system that we were a part of. My background, I was an educator, so I guess intuitively as a musician and someone that teaches people to learn by doing, I understood intuitively that that's a good component to have in an educational model. And I'm the type of person, and Joe is as well, that we just like to jump in and get things done, learn while we're doing things. And that's the way we learn. And we set the model up around that with Dr. Stewart's help. So when we went and spoke to Dr. Krasinski, those components came into it. But Dr. Krasinski, our director, is also very supportive of student leadership. And that's a big component of how she wants to run the program at Columbia, in that she wants students to be able to see where they want to go and help them get there. So when we came to her with this problem of, we want to do this and we don't know how, but we have this idea, we think we know how we want to do it, and it was originally a club, she saw the potential of it and encouraged us to not just do that, but take it one step forward and make it into a class and go big with it. And we're very thankful for that opportunity. So she knows the value of student-led education and supported it. And part of her being the director influenced us to understand the value of that going into that meeting.
So guys, I think this has been a really great perspective with that. And, something that we kind of want our audience to hear that's not only comprised of, healthcare providers, and also future educators, but also perhaps some current educators that are listening to this. And, this next question I got more specifically for Dr. Stewart here, what would you suggest, because obviously we want something that's kind of easily implementable, that faculty and programs can consider using something really quick and that's easy to implement to help.
Yeah.
What would you recommend to be a selling points to other faculty members to kind of help promote an idea that's similar to this, to a student-run directive, if perhaps there's hesitation?
Well, one, it's easy to implement. So, a lot of programs already have a lecture series of some sort. And if you add a little structure underneath of that and you start getting the students involved with that, that could easily take off in the direction that this course has taken off in. Certainly we have an advantageous position being in the city with so many different providers that we could pull from them. So maybe our location is good for that. However, with technology, you can pipe people in through Zoom or through Skype and do meetings that way and still get something out of it. So I think maybe technology's broken down those barriers. I think the single most important ingredient was the program director saying, do this, and definitely was on board. And so the barrier wasn't there, and that was unbeknownst to me because because Sean and Joe basically took that barrier down through those discussions that I was not a part of. So, but that made it really easy when the program director said, "Come on into my office. I want to tell you that these guys have a great idea. You should make it into a course." And I was like, "Okay, then it's happening."
Nice. And that hasn't cost any more money to the program or anything like that, has it, Lonnie?
It's minimal. So at each lecture, we've decided that we're going with our values. So despite the fact that we have some pizza there, we also have seltzer and tangerines and some sort of fruit and veggie option there as well. So it's really, I would say maybe we spend close to $75 for each meeting just to feed people and have them show up. I think that's just a good idea, but you certainly don't have to do that, but we do. Adds a little touch of class.
Yeah, I would assume bribery helps.
Are they all New York style pizzas, Chicago style pizza, Detroit style pizza?
It's New York. Yeah, we don't have. I guess I don't know where I would get the Chicago style. That'd be a special meeting.
So my question going off of that is, you guys have talked a lot about how a little bit previously how it's helped me get out into the community, network with other practitioners. But what about your clinical skills? How has being a part of this class made you better physical therapists?
So I feel that first and foremost, the main thing is that seeing it from the perspective of, say, a clinic director or even the CEO of a company, which is one of the values, perspectives that we've gotten through this class, shows me what it is that the company actually values, how the company is trying to achieve it, how the company is creating a culture that achieves those values and serves its customers. So when you come out of PT school, typically what you have is a perspective of, I'm trying to use my skills with this patient that's right in front of me. And there can be, a range of struggle with that. And what this class has added to me especially is I'm seeing more than just the patient in front of me. I'm seeing the healthcare system. I'm seeing the company. I'm seeing that specific clinic's values and how I can contribute and be a valuable member of that team, not just in the clinic, but the whole company and the whole healthcare system, how I can be valuable in adding value to the patient and how I work on that spectrum, getting them from where they are to where they need to be. So what has it added to me as a clinician is I can't even put into words the value it's given me personally.
No, Sean makes a really good point, and that's definitely something I've taken away. there's like multiple levels, right, of how this class has really made me a better clinician. And I think one way is that I now look at things from a different perspective and how to view things from multiple perspectives, right? So when you're sitting in a classroom and you're just trying to digest information, you're just like, okay, like, what am I trying to learn right now? What do I need to know for the test? And what do I need to know that I can take into the clinic? But when you flip the role of, okay, I'm not really like a student anymore. I'm trying to create an experience for my classmates and really drive home a point. Like, why are we bringing in this person? Why is it important? So we need to then frame the classroom or the environment in a way that helps drive home that message. And then you kind of go into class, like, that next day after we put on the class, we have to go into class. And then we think, okay, well, why is the professor saying it like this? Or why are they making this slideshow look like this? Or why are they having us do these types of techniques in this way? Maybe there's a different layer that they want us to take away here. And I think by kind of understanding that and then taking it to the clinic, you kind of realize that, okay, when you have to teach a patient something, or when you have to, advocate for them, there's multiple levels and there's multiple layers, and it's not just, what you might perceive at first. There's definitely usually more to the story than you.
So to add on to what Joe was saying, I think as a clinical PT, through this course, we're not developing our hands-on clinical skills, but we're developing a perspective of what is important to our patients. With the lectures that we heard so far, there have been some great lectures that focus on how can we be the best PTs for our patients? How can we put patient-centered care first? And then how can we be leaders that manage both other PTs as well as properly manage our patients and promote the best outcomes for them? So in the sense of becoming a better clinical PT, we're developing the skill set, that intangible type skill set, the skill set that isn't your hands-on skills, it's not your Therex skills, but it's the skills that really make you a great leader and a great educator for your patients and for the people around you.
I think that that's even more important, in my opinion, than even developing the clinical skills, because a lot of times patients are going to see that and react to that first. I do think that it's really important to develop clinical skills, but those can be learned very easily. You can take a course and practice those skills. And as you guys know, in school, you practice all the time for practicals. But one thing that I really appreciate about this conversation is that you bring up leadership so much, because this is something that is so important in our profession. And I've heard a lot of educators talk about how it is lacking in our profession. And Chad Cook made a very great argument last 2016 or 17 CSM during his Sarasoli lecture about how we need to be choosing physical therapist students based on these soft skills that you talk about, or these intangible skills. And the fact that you guys have an opportunity to work on this in real life versus just sitting in a classroom listening to somebody lecture to you about how leadership skills are important, you're actually putting them into action. And that's exactly what we do as PTs every single day, is we lead the patient down the right path so that they can get better. We motivate them to really see that they can get better. And then we advocate for them throughout our careers to make sure that they have great access to our care, that they can pay for our care, and that they are helping to get the word out that physical therapy can really help improve the quality of life of a lot of people. So I just want to say that I really appreciate what you guys are doing and what Dr. Stewart has helped you do, because this is something that I think is really needed more in our profession. And I really encourage any other educators out there, if you could contact our podcast and tell us what you guys are doing to help train leadership in your students, we would love to hear from you.
Yeah, that's a great point, Steph. And I think, it's not just about the leadership skills, but it's really about changing the educational model, because a lot of what's out there right now is stale. It's not working. It's not ideal. And the more and more guests we have on this podcast, and the more models that we see out there, the better the ideas are. And I think we're really starting to see some amazing ideas really taking root, really working. I mean, we interviewed a medical school that doesn't even use lectures anymore. So I mean, you know, these models are what we need more of out there. And Sean, I want to give you a bit of kudos for kind of starting this idea rolling from taking an experience from your past career in business and in education and really using it to put forth this next idea in your next career, if you will. And I kind of wanted to see, like, this thing kind of started with the idea that, hey, we kind of want to learn more about business and private practice, but it kind of sounds like it's morphing into a bigger breadth of possible new avenues and new guests that are going to be coming into lecture, not just private practice, not just business, but bigger areas of physical therapy and real world practice. So could you guys maybe talk a little bit about some of the directions this thing might be heading and bigger ideas that might be coming down the pipeline?
Yeah, so I loved everything that you just talked about in terms of the way that PT education is transforming, in the sense that things aren't black and white like the way we learn them in the classroom. There's so much gray area, and I think that this student-run elective class gives us some of that gray area. A lot of what we learn in school is prepping for a multiple choice test, and this class helps to bring in people who give us that fresh perspective of when you go out into the real world, things aren't, you know, straight black and white from your textbook. There's so much that we need to learn to develop those intangible skills. And I think another part, adding on to how PT education can transform, is this interdisciplinary approach, which is becoming more popular, and it's something that we really want to implement in this class. And I think that is the future of this class. We've been talking a lot in our weekly meetings about how we have this amazing opportunity at Columbia to be with nursing, medical students, public health students, and occupational therapy students. And we have this network of people that we can be working with. And we really need to tap into that. And we really need to establish interprofessional connections to enhance our education, because it's right there in front of us and we can easily grab onto it and we can really learn from each other. And I think that's the way that we need to go in the future, because in the real world, everything is interdisciplinary. In the hospital setting, in the outpatient setting, everything is interdisciplinary, and we need to implement that into our education.
So it sounds like, James, that one of the things that you would like to see changed in DPT education is having more leadership opportunities for students and working more on some of those diverse skills that aren't just black or white. I'm interested to know, and we ask this of all of our guests, what the rest of your thoughts are. And if you could change one aspect of DPT education, what would you want to change?
I think I started to touch on it already. And I think that the thing I would love to change is, from the get-go, making our physical therapy program more interdisciplinary, in the sense that I'm now in my second year of my program at Columbia, and I don't even know what the curriculum is for the medical students. And I get to see them here and there on campus, but I know a general sense of when their rotations are, when their didactic period is, but I don't even have a full comprehension of what classes they're taking at the same time that I'm taking classes. And that's so sad, because we're on the same campus, we share facilities. So I would love to change the way that PT students integrate with other healthcare professionals, making anatomy courses and orthopedic courses more integrated. Maybe physical therapy students can go to orthopedic surgeons and teach therapeutic exercise classes. So, and maybe orthopedic surgeons or students who are on the ortho track in the medical field can come and give lectures on surgeries. Just because there can be a disconnect in our professions, and it would be so easy to fix, because the opportunity is there. We can so easily learn from each other, and it would be extremely beneficial for both sides to take the knowledge that we're developing individually and collaborate together, because it'll help us in our future practice.
Well, yeah, well said. Well said. Is cost something we can change? I don't know if that falls in the scope of this conversation.
You can say that, Joe. Sure.
Oh, absolutely.
Instead, if you could change anything about DPT education, what would you change?
Hey,
Well,
there's
you
there's
know
some
what?
programs out there that are trying to cut the cost by cutting it down to 2 years. I mean, there are some innovative ideas out there, so we'll take all answers.
Well, and I think actually, in all seriousness, that's one thing that really sparked this class too. Is Sean and I, we looked at, look, what's like the debt to income ratio going to look like after school? I think that's something like fundamental. Okay, here's my concrete answers. Building more like basic financial education into a DPT curriculum, and to be honest, it needs to be in prior level educational curriculums more so, but. And I understand you also can't learn everything in DPT school, right? Like it's an entry level degree for a reason. And that's why there is continuing education and pursuing knowledge on your own. But yeah, like showing students that there are just so many other options other than just, yeah, like either, okay, like I can become a clinician, I could be a business owner or like a standard clinical owner, or I can go into education, I can do research. But I mean, there's just so many options. There's countless options of ways to improve our health system and just our health care, how we provide it in general.
So as far as what I think would be the most important thing to change, I'm going to give an umbrella term of leadership and give some explanation of that. I don't think leadership is something you learn about sitting in a classroom, getting a lecture on different personality styles and different ways of resolving issues and conflict, or learning psychology about leadership. You learn leadership by doing, and that can be anything from a simple project about what you want to develop as a career path as a clinician, which we've incorporated, to you reaching out and setting a new bar and really going out there and taking leadership over your own education and development, even while in school, like Joe and myself did. And I think we put so much pressure on multiple choice tests, like James brought up in the school, which is important. We all want to pass the licensing exam, but we kind of miss out when we are telling students we want them to be the leaders of the next generation, but all we're telling them how to lead is sit behind a desk and read a book, and you don't even get the human interaction with it. So my answer would definitely be leadership, and not just the leadership you talk about, but leadership where people is like, what do you want to do with your life? And then go do it.
Nice. Dr. Stewart, what would be your answer to if you could change one aspect? Well, I'm curious to hear what your response would be too, because there's been some great answers.
Those are some phenomenal answers, and I think it gives you an idea of the caliber of student I've been lucky to work with. And I really appreciate their perspective. And I'm still new at this, I'll admit. And so one of the things that I've seen are two themes that we have packed our curriculum so tight. It's like a can of tuna, and there is no extra room. There's no breathing room. And I don't know why students should be so stressed out going to PT school. I love what we do. We have a certain expertise that we have to learn, definitely, but I wish there were a little breathing room in there for them to get some experience in the real world other than just their clinical education, which is one important aspect of this elective. And then two, creating cultures. I thought up at the beginning of the year to tell the first year students that when I had the bully pulpit and I was in front of the class, I said, you know what? I want you to begin creating your professional persona right now. I want you to begin creating the culture that you would want to work in and live in and study in. Say hi to each other when you go down the hall. Create these cultures, because I was really fortunate. My first job out of school was at a great place. It had a great culture. And when you move from that and you perhaps have a family member that's in the medical care system. I had my mother-in-law unfortunately passed away last summer, but when we were in the hospital, I thought to myself, man, these people are getting away with acting so unprofessionally. It was so upsetting that in New York City, we should have great institutions of healthcare. And that's just not the fact. Across the country, I know people are pressured, and I know the medical system is pressured, and I know certain people don't get paid a certain amount, but still we can create that kind of culture where we'd still like to come in and work within. And it's good for the patients, and it's good for ourselves. Create the culture you want.
No, I love that. I think those are some absolutely fantastic takes, because I think just listening to everyone speak here tonight, I've definitely really learned quite a bit from you guys too. And I hope that our audience, comprised of students, other healthcare providers, but also educators as well, can definitely listen to what's been said and these suggestions. And guys, before we kind of wrap up here, where can people find you guys online or on social media if they want to connect with you or kind of ask further questions about this program and initiative?
Yeah, so you can, my email is jlipsky18 at gmail.com if you ever want to, get in touch and connect more. But my Facebook is Joe Lipsky, JOE space LIPSKY. My Instagram and Twitter are both the same, so it's just Joseph_Lipsky1. Happy to talk about the class anytime.
This is Dr. Stewart. I'm at Mahlon Stewart on Twitter, at MAHLON STEWART, at Mahlon Stewart. I think that's the best place to get me.
You can find me on Facebook, Sean Whited. My name is SHAUN, last name WHITED. At Twitter, you can get me at Sean_Whited. You can reach out to me via email with whited.sean@gmail.com. And you can also find me on Facebook. Please reach out. I'd love to chat and help maybe any questions you have or just to chat about different ideas.
You guys can find me on Facebook, James Sinodinos, SINODINOS. My email is jsinodinos, same spelling, 2 at gmail.com. And my Instagram is j_SINO. Any questions? Would love to hear about any ideas anyone has. Any comments on the class that we have at Columbia? Thank you.
I can't wait to see what big things you guys are going to bring into the profession once you graduate. So appreciate all you're doing out there to really push the needle forward. And Dr. Stewart, thank you as well.
Hey, everybody. Thank you for listening to the Healthcare Education Transformation Podcast, as we greatly appreciate your support to help us advance healthcare education. We are very happy to announce that we have created a new tool to help develop clinicians into better experts. With that being said, we have created the HET Light tool, which LIGHT stands for Learning Integrated Towards Expertise. And what we've done is we've taken our first year's worth of episodes with experts in the fields of healthcare and education, and we've taken one golden nugget or theory on expertise and presented it to you in a very easily consumable format, so that people can take one lesson or nugget per week and map out and plan how to incorporate it into your clinical and educational practices. And by the end of the year, we think you'll be pleasantly surprised at how far you've progressed towards becoming an expert. To find out more, please check it out at pteducator.com/HET, which is also available in our show notes. Thank you again all for your continued support. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter at HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.